So today we're going to be talking all about hip hinge movements. So looking at things like conventional deadlifting, we're looking at things like Romanian deadlifts, and even things like good mornings. Whether you're doing it with a barbell or a dumbbell or whatever implement it is, the common complaint that I get from people is when they're doing these exercises is they feel their lower back. So this might be bad pain, some kind of pinching, some kind of spasm. We're not going to get too deeply into that specifically, but it could also just be that they feel their erectors working a lot more than they feel they should. Because the reality is, when we do these exercises, these are all hip extension based movements. We're trying to train the hip extensors. We're trying to get the glutes and the hamstrings. So when you're getting a lot through the erectors and they start to dominate the exercise, that is something we can be addressing with our technique. So the first thing that I often see with these people is not getting appropriate amounts of bracing strength through their midsection, through their core. And core doesn't just include the abs here, it also includes how you're breathing, and it also includes your lats. So typically, when I see people doing hip hinge movements like a Romanian deadlift, let's spin this around to the side for you guys, is they think about pushing their bum back and lifting their chest because they think this is really good posture. And I would say that hips back and chest up are probably two of the most overused and poorly understood cues in training, especially when we're looking at things like squatting and deadlift or hip hinge motions. So what you'll see is, let's get this bar off the ground. Here, if I'm standing upright and I first of all think of pushing my bum back and lifting my chest up, you can see I'm in massive amounts of extension through my spine. As I descend down, I might be able to get a fair bit of a stretch through my hamstrings, but what tends to happen here is if I'm thinking about arching my back, this movement from here to here, you can see my lower back is going into extension and I'm moving through my low back, but my hips aren't going further into flexion or extension as I'm lifting up. So all that extra movement I was just doing there with the bar is coming from my spine and coming from my back muscles, not from my glutes and hamstrings, which honestly is not necessarily wrong if you don't mind training those muscles, but I would say that it's inefficient because you're doing an exercise that's designed to be hitting glutes, hamstrings, a little bit of adductor, a little bit of erector, and you're doing it in a way that's going to promote a lot more erector and not much out of the other muscles. And I would say that there are better movements you could be choosing if you wanted to train your erectors on their own. So it all comes back to this efficiency. We want to move this weight as efficiently as possible and take our glutes and our hamstrings to as much of a contractile range as possible and hopefully get to a point where when we reach close to a failure point, it's the glutes and hamstrings that are fatiguing, not the lower back. So how do I go about curing this? The first thing is looking at rib and pelvis position. The entire time through the whole range of motion, I want people to be thinking about keeping their ribs stacked over their pelvis. Common fault is with this chest up cueing and arching the back and pushing the bum back, it creates a lot of this anterior tipping, putting your back into massive amounts of extension and lifting the chest up and flaring the rib cage out. And you can see in this position here, it looks really weird. And maybe don't do it this excessively, but any degree away from here and towards this position is going to be less efficient and less ideal for the glutes and the hamstrings. So here in this position, my pelvis is well behind my ribs and my ribs are flared up. My abs are elongated and stretched out and my lats are really compressed and short and not able to contribute much to stability of the spine. So let's break it down piece by piece and make this a little bit more usable for you guys. The first thing I do is just make sure you're standing in a position where your ribs are stacked over your pelvis. From here, I like to cue nasal breathing initially, although you can get away from it long term. The reason why I cue nasal breathing is nasal breathing tends to create an automatic, unconscious contraction through your diaphragm. Where if you put your hand into your side just here, take a deep breath in through your nose, you'll feel expansion happening through your midsection as your body creates this intra-abdominal pressure. And there's no change in my rib position as I do that. So again for you, I'm relaxed and I'm expanding out and nothing here has really changed. Whereas if I did a lot of mouth breathing, it's not unusual when you take a big chest breath and a big mouth breath to suck in there like that and create that flare. Of course, it is possible and very easy to breathe through the mouth without lifting the ribs up as well, but just to make it a lot easier from a coaching perspective and help you nail it, I say ribs over pelvis, nasal breathing. And then as you master that, if you want to for comfort, you can get away from the nasal breathing. So, ribs stacked over pelvis, nasal inhalation. The next thing I think about is I want to get my lats contracting to stabilize my body. When we think about core muscles, people often think about the TVA, they think about their abs, they think about their obliques, but they're forgetting about the lats. And the lats cover the largest surface area around the spine with many, many different attachments to the spine and through this whole low back section. So we should be thinking about them bracing as well to support our body when we're going through a squat, a deadlift, or any kind of hip hinge movement. The way that I cue this with people is, again, setting all these positions up with the ribs over pelvis, nasal inhalation, is reaching the hands down towards the ground and pinching your armpits in towards your hips and pulling the arm back slightly into extension. Now, of course, with the bar in your hand, you're not going to get your hands all the way back here, but that tension and that goal of trying to create that extension is going to get the lats engaging. So what we'll be looking at here is setting myself up, ribs over pelvis, pushing my hips back, grabbing onto the bar and pulling into that extension position. From the top position here, what you'll see is everything from my shoulder down to my pelvis remains quite static. And when I go through the Romanian deadlift motion, everything hinges back as one unit. And then as I come up, it all comes up together as one unit. So by keeping my head relatively neutral, although it's not wrong to lift your chin up just slightly if you wanted to, but the big thing here is my pelvis is staying stacked directly below my rib cage, big nasal inhalation, lats are pinching in, pushing everything back in one movement. Again, to show you the incorrect movement, that would be where instead of hinging back like so, with everything moving together, I'll be moving back like this, where my lower back arches and I hinge my bum away into extension and I start to crank up through my back like this. Now that does not feel good whatsoever. So, there you have it, guys. Quick recap for you, whether you're squatting, deadlifting, although we're focusing a little bit more here on the Romanian deadlift, is to make sure it's as much for your glutes and hamstrings. Make sure you're going through hip extension, not lower back extension. They're two very different things, and they look very, very different here, so hopefully you can see that. Ribs over pelvis, nasal inhalation, lats engaging, and then perform the hip hinge motion with all of those things remaining constant. Hope you guys found that useful. If you guys have any other questions, please do drop them below in the comment section. I'm just realizing how hard it is to maintain talking whilst deadlifting, so we need to stop recording this video very, very soon. But don't forget to like the video, subscribe to the channel, share it with your friends, share it with everybody, and we'll see you guys next time.